Are you ready to bear it all? Welcome to tonight's virtual event, an event around how you can bare your natural skin using some natural rejuvenation treatments such as Sculptra and radiofrequency microneedling. For being here tonight, you will get a $100 gift card added to your account that you can use up to the end of August. Stick around to the very end so you can ask the providers your questions on any of the treatment and presentation that we discuss. This is the newest injectable treatment, a biostimulator that stimulates your own natural collagen. I'm talking about Sculptra.
My name is Angie McKnight. I'm a physician assistant. I've been injecting and doing lasers for 18 years. Sculptra provides a very natural looking result that is very gradual. For example, you would do the treatment, you would wait for the collagen to be produced over the next 2 months. So at first, when you first inject, the face looks very full, but that's just the water making the face look full. About a week later, you don't really look like you've had a procedure done. And then over the next several weeks, up to 2 months, you get collagen production, you start looking more full, and people start noticing your skin and seeing that your skin looks smoother, you look like you've been using a new product, and it's a very natural looking result. The areas that you can treat with Sculptra are the temples, you can treat the cheeks. Specifically, if you treat the cheeks on the lateral part of the cheek, the lateral zygoma, the preauricular region, and then the gonial angle, which is this outer part of your jawline, that can lift your face, which can help with jowling that a lot of us hate. You can also treat the distal marionette lines, not all the way to the corner of your mouth, but you can treat the lower part across the sulcus mentalis, which is this line on your chin. So not only will it give you volume in those areas, but it'll also improve texture and lines. The third thing would be that you're improving the lines at the same time. Sculptra can also be used on the body in areas such as the buttocks, the thighs, the décolleté, and the upper arms. And it can be used in all those areas for cellulite, for wrinkling. On the buttocks, you can actually give some natural looking volume. It's not going to be like a BBL, but it will improve volume, cellulite, and sagging of the buttocks all with the same treatment. Botox is working on areas of movement such as the forehead, the frown lines, the crow's feet. You can even use it to give a brow lift, but you're working by immobilizing muscles. So if whatever muscle does, for example, if in the glabella, if you frown, it pulls down. If I relax that area, it's going to give you a lift. But you're not replacing any volume loss with Botox. And when you do Sculptra, you're actually getting your fibroblasts to produce collagen, so it gives you volume and improvement of your skin quality all at the same time, but it's a treatment that you have to do more than one time. So you would do the treatment, wait for the collagen to be produced over the next 2 months, and then we would assess whether to do it again. And most people need multiple treatments. Sculptra can be put everywhere. So for example, for lip volume or for lines around the lips, it's not a safe place to put Sculptra because of risk of nodule formation, so you'd want to put a filler, and that's very safe to do. So a filler is made up of hyaluronic acid, and it's a gel that we inject into the area, and it's an instant volume. You're not relying on your own body to produce collagen, and the results typically last about a year. Sculptra typically lasts about 2 years, and your Botox is lasting 3 to 4 months. So after the Sculptra procedure, you're going to want to massage your face 5 times a day, 5 minutes at a time for 5 days. And this is really easy to do. It's just a massage like this. And, those are really mostly guidelines, for massage. You could even massage it 1 to 2 minutes more frequently throughout the day if that's more convenient for you or your job and you have a hard time, doing the 5-5-5. Sometimes some people will tell me that they have a little discomfort whenever they're massaging. It's easily treatable from Tylenol, and usually you take it 1 or 2 times, and then it doesn't hurt anymore when you massage. You can start getting Sculptra really at any age whenever we notice that you're having some volume loss. Me personally, I started getting Sculptra when I was 35. I'd had 2 children, and I had been running, and my face got very thin, and I tried to do filler, and filler's great, but it just wasn't addressing everything I wanted to treat. So I did 2 bottles of Sculptra, and just adding that volume everywhere gives you a more youthful looking appearance That result lasted me for a long time. You know, when I got the Sculptra, it lasted me about 2 years at that age where I didn't have to do anything more to my face. And then I would do about a vial or two every 2 years to maintain that result. And that brings me to now. I'm 44 years old and I'm continuing to do it. And I think it's honestly the fountain of youth.
This groundbreaking skin treatment called radiofrequency microneedling is the secret to tightening skin. Come learn more.
Hi, I'm Heidi. I have been at Elase for 12 years, and I am a master esthetician, instructor, and corporate Elase trainer for Elase. What RF microneedling does is it actually goes in with needles, depending on the device we use. It will go into the skin, and then it actually heats the skin. And so it's the perfect way to be able to wake up that collagen elastin, and this is a great way to get that tightening effect that we need in our skin. If you feel like you're getting that laxity and you feel like things are starting to kind of go downhill as we age and things like that, and we're not someone that wants to do tons and tons of fillers or injectables in our skin, the best way to do that is RF microneedling. About 80% of our skin is created with proteins, and collagen is a protein. It has the most of the collagen, and elastin is an additional protein that's being created in our skin. In our late 20s, that already starts to break down. In our 30s, it goes to 1% breaking down a year. And I like to use a kind of a phrase that people understand. It's like we're born as this nice, beautiful block of cheese, and as we age, it kind of turns into Swiss cheese. And so we have these little holes, big holes, spaces, and so what we are trying to do is reconnect the areas that have those holes. I like to see them at least 3 times every 4 to 6 weeks. And that 4 weeks would be a, say, 30-year-old. 5 weeks would be a 40-year-old, and 6 weeks would be a 50+. And the main reason is our cellular turnover slows down as we age, so we want to make sure we're actually treating skin again that's newer and not an older skin. And so that cellular turnover is really important to make sure that we're treating correctly and actually getting the best results for that RF microneedling we do. When we treat with RF microneedling in the face, we're going to treat at that 4 to 6 week mark. It takes longer for body parts to heal. And so now we're in the 6 to 8 weeks. And so at 6 weeks is that 20 to 30-year-old. 40-year-old would be the 7 weeks, and 50+ would be the 8 weeks. There's such an array of skin concerns that we can treat with RF microneedling. Main would be the tightening, but we can help with fine lines, wrinkles. We can help with our tone and our texture of our skin. We can do hair restoration. Neck is a huge one. We're seeing a lot of younger patients coming in with what we call tech neck from looking down at their screens all the time. Décolleté, our chest area, arms. We can treat fat pockets in your bra area. We can treat stretch marks. We can treat reds and whites. We can do buttocks. We can do tightening in the areas of the knees. A lot of plastic surgeons struggle with tightening knees or doing treatments with knees. RF microneedling is amazing to treat knees. With RF microneedling, there is a tiny bit of pain, a little spiciness in there, but we make sure that we provide numbing cream for you. We want you here between 30 minutes and an hour before to numb for your comfort. We also offer Pronox, which is like a laughing gas to make sure you're fully comfortable during the treatment. I've never had someone get up and start crying, so I think we're doing good on the pain modification. But again, the second we're finished, it's such a nice thing because they are fine. Radiofrequency microneedling, we're in clinic and we're doing that, but 80% of our results are actually being done at home. The best thing to pre-treat the skin with would be an HA, a hyaluronic acid of some kind. That helps to make sure that the skin is nice and supple. RF microneedling doesn't necessarily have a target in the skin, but if it did, it would be water. So the more water we have on the top surface of our skin, the better the results we're gonna get. And then post-treatment, we want them protecting their skin with hyaluronic acids and giving that plumping, healthy skin effect to their skin. We want them on a blue light protector. Blue light goes deeper in the skin than the burning rays of the sun. People don't realize that's actually the tanning bed of this century as far as aging goes. So we want to make sure you are taking care of your skin, not just in clinic, but you are on a good regimen of amazing medical grade products out of the clinic at home. It stands out. It's the world's first and only RF microneedling device that has what we call dual wave technology. We can treat reds, browns, melasma. We can treat hair restoration, things that we were never able to do just with microneedling on its own. Something that really stands out with Silpharm RX compared to others is we're actually able to go both upper and lower to the actual lash line. We've never been able to do that with any RF microneedling before. So that means we're treating the inner orbital part of the eye where we need that nice tightening effect. We're able to treat not just the tightening, but if they have some reds or some dark under their eyes, and that's more of a vascular issue, we're able to calm that down too. If we're going to do RF microneedling, we first want to make sure that if they're doing their injectables, they either do those 4 weeks before their RF microneedling, or they wait a minimum of 2 weeks post microneedling to do that treatment. That's going to be the best results and make sure that we assist the injectables that they're doing and not cause any issues with their injectables.
I'm Sammy. I have been a PA for 6 years now, and I work at Elase Town Center. And I'm Steph. I've been a PA for 6 years too, and I work at Elase Town Center and then also Ponte Vedra. Morpheus is radiofrequency microneedling. It's an advanced microneedling treatment that uses tiny needles with heat to tighten the skin. They can also burn fat at deeper levels. It helps with texture and tone of the skin. There are a lot of misconceptions about Morpheus 8 and the pain, and really our patients are not in any pain at all. I have never had a patient complain or have needed to stop the procedure. Really it comes down to the numbing time, and if we numb them for long enough, and we have really good numbing cream here, and it works really well. I would recommend Sculptra with Morpheus 8 to really boost collagen. Sculptra is a really good way to kind of build back that structure that was lost over time with aging. I do think a lot of people kind of don't think about collagen stimulating treatments and treating the skin. They just think of injectables, and which are great too in combination, but I think it's really important to kind of restore the underlying foundation of your skin, and that's something that Morpheus does.
It is time to bear it all with your most natural, beautiful self. Thank you so much for attending this virtual event. Please stick around so you can ask some live questions about some of these treatments to our providers. Thank you and see you soon.